It's rare to see Jacqueline Langley without a piano close by, but a recent fall injuring her shoulder has prevented her from doing what she loves.
I have found it difficult the last couple of years to be able to play freely, and so I'm looking forward to getting back to that.
Yet a rare new surgery could see her back on the keys in 4 weeks. She's one of just 36 people who's gone under the knife for this groundbreaking navigational surgery, which uses pinpoint accuracy.
It's the same operation we've been doing for 10 years. There's no different implants, there's no different technique. It's just we're doing what we always do, but we're getting this constant feedback to make sure we get 100% accuracy.
A CAT scan of the patient's bones are downloaded onto the computer and a map of the surgery is created before even entering the operating room. Then, using tracking tools, the implant is inserted with perfection.
So the computer assists the surgeon in reaching the perfection, but it's not actually robotic. It's the surgeon still using their own hands.
The equipment is not only reducing time spent in the operating room, it's also improving patient outcomes, which means they're less likely to run into trouble down the track.
We realised by getting alignment within the shoulder joint just perfect, it'll work better, it'll function better, and it'll last longer.
A result Jackie is looking forward to, along with many other patients in the region who are awaiting surgery.
It's an amazing operation, and to have Jackie participating in the first of the new bionic shoulder is marvellous, and we feel very privileged.
The best technology in the world is here. You know, there's nothing better anywhere else in the world when we're doing shoulder replacements anyway. The high-tech stuff is in the Illawarra.
Kimberly Pratt, Win News.